All right, we're here today with Laura, and Laura's about to start her treatment with Dr. Davis. So Laura, what brought you into the office?
Just some pain in my knee and shoulders and some of the areas I'm working on.
How long have you been suffering with this knee pain?
About over 3 years.
Okay. And was it due to a slip and fall or any kind of an injury or anything?
Not really, just over time.
It just
been
kept
feeling
getting
pain.
worse.
Yeah.
Yeah. So what is your discomfort level now? Zero being no discomfort and 10 being unbearable.
Today it's at 5, but it fluctuates during the week.
Okay. And it probably just depends on how long you've been on it.
Yes.
Right. Okay. Have you seen any other doctors for this?
No, not for the knee.
All right, so this is your first attempt to get it corrected. I'm gonna have you do a couple different exercises for me, and I really want you to focus on where you're feeling the pain. So if you could just stand up for me. How did you feel there?
I felt decent.
Okay, did you have any pain in the knee when you did
A
that?
little bit.
And could you point to where it was hurting?
On the front.
Right in the front of that right knee. So your right knee's worse than your left. Okay. All right, I'm gonna have you take one step forward. I want you to put your feet shoulder length apart, arms straight out in front, and I'm keeping your heels on the ground. I'm gonna have you squat down for me. And just do the best you can, I know. And slowly come back up. And where did you feel that?
Here in the same area.
Okay, did you feel anything in the left?
Not too much.
Next thing I'm gonna have you do is I'm gonna have you go up and down the stairs. Go ahead and come on down. All right, now we're gonna go back up the stairs. Now, Laura, how was that? Where did you feel the pain?
I still felt it
In the front of that right knee, but it was more on the top of the knee?
I'm going on.
Going up the stairs, so up the stairs was worse than going down.
A little bit, yeah.
All right, perfect. All right, we're gonna get you started. Are you ready?
Yes.
Let's do it.
Breathe, pull. You got it, there we go, one more. There we go.
Wow, look how far that went that time. Jeez.
Woo, that was smooth, you got it, you can do it.
You doing okay?
Laura, you got this.
Foot out, and down. Down, down. Good.
Perfect. How's that feel? Look at that smile. Come on back. What feels different?
I felt totally different. Like, I felt normal.
You feel like you're walking smoother, those joints are moving like it's supposed to.
Yeah.
Wait till you go outside and do the outside. Laura's finished her treatment. So, Laura, can you stand up for me? All right. Now let's try to do that squat. Take one step forward, feet shoulder length apart, arms out in front. How low can you go? Wow. Oh, that was awesome. All right, let's do the stairs. All right, down the stairs. Nice, smooth movements. All right, and back up the stairs. All right, Laura, how do you feel?
I feel really good. Yeah.
Your pain level was a 5 when we started. What do you think your pain level is now?
0.
0. You're not feeling any pain at all? And one of your biggest problems was going up those stairs. You're not feeling it anymore?
Nothing.
So was it worth it?
It's definitely.
Welcome aboard, Laura. Now we're going to get you on nutrition and we're going to get you into the therapies. It's going to feel even better.